Well, welcome back and good morning to Elena Marks, the president and CEO of the Episcopal Health Foundation that recently awarded $5 million. Very interesting that you did that to use in the fight against COVID-19. Good morning, Elena.
Good morning.
Tell me, where specifically is that money supposed to be used?
Well, it's being used throughout the 57 counties that we serve that are in central and east and southeast Texas. And all of those dollars went to organizations with whom we've been in partnership, some for many, many years and some more recently. And the idea is that the partners with whom we do good work year in and year out, we want them to survive. We want them to thrive and to get through COVID. And so these funds were made available so that they could continue doing their work, so that the losses that many of them sustained could be buffered a little bit. And we want them to be strong and healthy when we come out of COVID, because at some point we will.
Right. On your website, it says rooted in faith and active in hope, and that you believe that all Texans deserve to live a healthy life, especially the poor and those with the least resources. Now, from research I've read and that your organization acknowledges, Texas has a lot of poor when it comes to health care. How bad is it in Texas as we speak?
Well, in terms of access to health care, we have had the highest number and the highest rate of uninsured people in the country for a long time. And that's not something to be proud of. And that means that those people don't have access to health care. Are not affordable health care and often not outside of the emergency room. A bigger problem for us and what we really want to try to address are the underlying causes of poor health outcomes and poor health status. And health care is really important, but it really only accounts for about 20% of health outcomes. And we're seeing in the case of COVID that it's not health care that determines whether someone is going to get COVID. And frankly, it's not health care that determines how sick someone's going to get from COVID. We are seeing a disproportionate impact on low-income communities of color who don't have the benefits that allow you to isolate and take other kinds of precaution to prevent being infected with COVID in the first place. And because those same populations have underlying health conditions that have festered for decades because of the communities and situations in which they live, they are more likely to be extra sick and to die from COVID if they do get infected. So they get a double whammy, and healthcare can only do so much. The real solutions to these problems, including the COVID problem, have to do with things that happen outside of the medical system and in communities.
You talked about the health insurance crisis in the state that is poised right now perhaps to go from bad to worse. Talk about the fact that the Affordable Care Act, which some have tried to do away with over the number of years, it really has been what potentially a godsend for some people who are hurt by COVID-19, and the lack of Medicaid expansion makes it even more problematic, does it not?
Absolutely. So we've got more than 1 million Texans who signed up for ACA marketplace plans, and 85% of those get subsidies. So these are very affordable plans. What we're seeing now in COVID, and some of our research has shown that people who've lost jobs just in the first 2 months, so if you look at the people who lost jobs in Texas in just March and April due to COVID, you see that there are about 1.6 million 1.6 million people who are likely to become uninsured. And the reason for that is that most people get their insurance from employers, and not just the individual who's employed, but often their spouse and their children are covered by plans that are sponsored by the employer. And so what we have seen is that as people are losing their jobs, they're also losing the health insurance that came along with those jobs. And it's not just the individual who lost the job, but it can be the entire household who has lost their means of access to affordable health care. Now, some of those people are eligible right now for Medicaid and for ACA plans. They don't necessarily know that. And so part of what we need to be doing today is making sure that those people understand that just because you've lost your job and you've lost your health insurance that came with the job, you may be eligible for Medicaid, even under current Medicaid restricted rules. And you may also be eligible for a subsidized plan in the marketplace. And our data shows that right now, about 3/4 of the people who have lost insurance are probably eligible for one of those two pathways.
So
go ahead.
You've been a realist about and optimistic as well, though. What are you hoping legislators will do, and how the community can also respond to make some needed changes right now?
Well, our hope is still that the Texas legislature will expand Medicaid. There is a wealth of data that shows that in addition to the improvement in health outcomes for people who gain insurance coverage, there is also an economic benefit to state and local government coffers and to the healthcare sector. And so it is a win-win for the state to expand Medicaid. And when we're seeing unprecedented unemployment and people losing the opportunity to have insurance that was heavily subsidized by employers, Medicaid expansion is an even more compelling argument. And we hope to see that in the next legislative session.
Well, go ahead.
The state has been an opponent of the Affordable Care Act from the beginning. In fact, is the lead plaintiff in a suit to have it declared unconstitutional. That would all be fine if the state had another plan, and we have not seen anything out of the state in the 10 years since the Affordable Care Act has been the law of the land that shows what the state of Texas would do to make sure that its residents have access to affordable health insurance products.
Well, we'll continue to watch you on the front lines, and hopefully there'll be some changes made that'll help those people who need the insurance and wondering how they can be more healthy and have the coverage that they need. Elena Marks, thank you. Thank you for all you do. Thank you for your organization and you personally, because I know you're passionate about this. Good luck in going forward.
Thanks very much.
We're going forward to next week. That and final thoughts about the cross burned on my yard that created a lifelong awareness and resolve when Houston Newsmakers continues.